And let's see, I'm looking through the list. We've got some people on the phone. Anyone else on the phone? There might be a few.
Rima, did you see that I'm here? This is Brian.
Okay, yes. Okay, I see some people on the list here. Sorry, it's taking a little longer than normal, but I think that's about everyone, I hope. Okay. Now, finally, we can dive into the agenda. Thanks for your patience there. So is there any public comment? Okay, seeing none. Unfortunately, we cannot approve the minutes because we don't have a quorum. But does anybody have any comments about the past minutes? This is kind of from a while back.
Hi, Rima. This is Shelley. And on the agency updates from the December meeting minutes for it should be FCRT that we are receiving new vehicles, and you have it down as C, not T. It is T.
Okay, got it. Thanks for that. Okay. All right. Any other comments on the minutes? Okay. All right. Well, we will go through provider and agency updates as best we can on the phone. Let's see. I'm just going to go down my list here. So I guess, Shelley, would you like to start?
Sure. We are picking up our 2 vehicles this week for FCRT on Thursday. And that's really all I have, I think.
Perfect. Okay. Next, going down the list, anyone from Fulton County here? They want to say anything?
This is Audra. I don't have anything else to add other than what Shelley said.
Okay. All right. We have anyone from Knox County, KCCDD, Galesburg Transit. Anyone from Knox County want to just give your update? I know, Ryan, you're pretty new, so if you want to.
Yeah, I'm just kind of trying to understand what's going on.
Okay, that's perfectly fine.
Yeah, sorry, Ryan, could you maybe just introduce yourself to the rest of the group? I know you've sent Rima and I a message, but.
Yeah, I'm Ryan Berger. I'm the Community Development Director for the City of Galesburg. The city had contracted out its transit services to Galesburg Transit, but we canceled that contract. And so now the city is directly administering the transportation component. So I am now in charge of that. Also looking for a transit manager. So.
All right. Anyone knows
Need someone with some expertise.
Potential job opening. Okay. Well, thank you for that. Appreciate it. And so now we have, is anyone from Marshall County here that wants to comment? I don't think anyone was here.
This is Tracy. We haven't really had any changes with anything other than we're kind of starting to pick up as far as our transports go.
Okay. All right. Great. Thank you. So next on my list is Peoria County. So either Mary or Andy, you want to say?
Okay. Is Andy there? Otherwise, okay, it's Mary. With AARP, right now we've been working a lot on nursing homes and the effect of this coronavirus on the residents. We're looking for funding from the feds and the state to make sure there's better safety procedures. I'm wondering if I could now or later on ask this question of the people who are there that handle transportation. my understanding was that in the past that some of you would pick up nursing home residents to take them to some procedures in the hospitals like dialysis. Then I had heard that some had stopped doing that, not because of the coronavirus, but simply because it was too expensive. And now with the coronavirus, I'm wondering what you're all doing about the residents that need to get to the hospitals. I'm not talking about elective surgery or anything. I'm just talking about those procedures that are necessary, like dialysis.
Okay, yeah, I mean, we can talk about that now since we're on the subject. Does anyone have further comments about that?
Rima, Brandon Hovey here. I think that's an important concern. That's a concern that's very near and dear to my heart. I have two grandparents. They're not in nursing homes, but they both suffer from chronic kidney disease. They're not dialysis patients, but dialysis is one of those things that can preserve lives. And if there's transportation to that, we need to facilitate that.
Okay, and I forgot which, I'm on the phone, so I can't see who you are. Who do you represent?
Are you addressing me, ma'am? Brandon
Yes.
Hovey?
Yeah.
I'm a Tazewell County board member.
Oh, okay. Thank you.
You're welcome, ma'am.
Mm-hmm.
Yeah, I guess, well, Andy is next on my list anyway. So if you have any comments about that, you can go ahead, or you can just give a general update.
Okay.
Yeah, I can pop right on, and then I'll just get right into my update after that.
Mhm.
As far as any medical appointment, any elective medical, anything that our passengers deem necessary or essential, we are providing transit for. It does not matter where they're going, what they're going for. It's totally up to our passengers. So we're gaining the capacities to do that on both of our services. In addition to that, we are taking an extra step. As of now, as businesses are opening back up, we're not doing it as frequently. However, initially we were reaching out to some of those businesses to ensure that they were in fact open, to better assist our passengers, to make sure that they were not left out at a location for an hour or two when they did not have the capacities to reach us to get a return ride. So on our end, we're not doing anything extraordinary or different. Any trip that they request, we're doing our best to provide. Jumping into my update, our paratransit and rural transit RFP has returned. We have 5 bidders on that. We're looking at the completion of our current contract with MB come the end of November 30th. Paratransit software, that is going to our board with an expected approval this upcoming Monday. Recently, we have engaged with my partners at MV, CityLift and CountyLink. We have engaged our social service agencies about their return to work phasing plans, looking at all the different riderships that are coming back. They're looking at bringing things up to 20, 40, 60, and then so on. We have 3 major providers in the area, in addition to the dialysis centers that we're currently serving. We expect to have some capacity concerns right about 35 to 45% of resumption with 3 to 4 passengers or like residences traveling to locations. That presents a major hurdle for us to jump over. We've engaged those social service agencies with questions such as, what is your plan? How do you propose bringing additional people back? What can you do to assist us? The one organization, Dawn's, we spoke with the other day, they're asking families to bring individuals back for the short term. And we're just having those discussions, and we're being very transparent about what we're going to be able to handle and what we're not going to be able to handle. The expectation from Dawn and her team at Epic specifically was that they don't expect everyone to come back. So the numbers we're targeting, about 66%, maybe 2/3 will be coming back to work during this time frame. However, we start running into capacity issues at about 35 to 45%. You take roughly on average at those peak times 10 persons per vehicle, and then you bring it down to 3, maybe 4, depending upon if you have a wheelchair on, and you're running into quite a bit of concerns from your passengers, social distancing guidelines throughout the whole system. And that's really what we've been spending most of our time doing. Brian or Mick, I know you're on the call. If you have any additional updates to anything that I missed or you want to hammer home, please feel free to jump in.
Just the only thing I want to add is just that we are currently bringing back as many drivers as possible. There's a couple of them that will not be coming back, and Andy, I can get back with you on that one. And we did just recently have to hire a new dispatch manager, so our safety manager actually has been moved over to our dispatch manager position, and she's been doing a great job since she's been over there. Now we're currently looking for a safety manager, but other than that, I don't have anything else to add to what Andy has added.
Okay. Thank you both. All right. Looks like next on my list was Stark County, but we already heard from Tracy, so appreciate that. And Tazewell County. Brandon, do you have anything to update?
Truth be told, Rima, since I'm brand new, I just want to issue an apology. I've not been a very dutiful member of this committee. Part of that has to do because of COVID effects on my personal life and poor scheduling and poor calendar management on my end, but I'm happy to be here finally, and I'm be committed to being here finally. Thank you.
Appreciate that. And honestly, we've had a lot of hiccups with COVID as well. So if you notice, the last meeting minutes were from December, which is a while ago. Which we meant to meet in person, I believe, in February, but there was too much snow that day. So whether it's the pandemic or the weather, always something. All right. Okay, so next on my list we have Woodford County. I don't believe anyone was here from Woodford County. Is there anyone who wants to comment? No. Okay, so I've got Epic up next. Dawn, do you have any further updates?
The only thing that's going on with us, like Andy said, we met with him and his team yesterday in regards of a soft opening that we are getting ready to do. IDPH is actually requiring us to only bring in 25 individuals at a time per shift. So it'll actually make it out to be where there'll be 50 people at our building in a day's time. As of right now, Peoria Production had made protective shields for our bus. So we are having the protective shields installed in all of our buses. It will take down the capacity of a bus from a 14-passenger bus all the way down to maybe a 6 or a 7-passenger bus. But right now, we're not actually, looking for everyone to come back. Like Andy said, that we are requiring our host providers, guardians, and family, if they do want their individuals to come back to our day program, they're required to transport at first until everything is stable. And then we'll go ahead and get City Lift involved. But we will mainly pick up most of the transportation, Epic themselves. And that's pretty much with us.
All right. Okay, perfect. Thank you. Okay, so I have up next Advocates for Access. I don't think Adam was here, so we'll skip that. And let's see. I think Renee is next on my list for the Agency on Aging. Do you have any updates?
We're still transporting our passengers, our clients. We do ask that they wear masks, as most people are now. And we do sanitize between each rider. But right now, the ridership is down, like some of you have also experienced, that people are kind of determining for themselves whether it is an essential trip that they need to actually take or not. And we're leaving that up to the participants to make that choice.
Okay.
So that's about it for now.
All right. Thanks, Renee. I see we've got Greg Cassidy. I know he's on here. Do you have any updates, Greg?
I know, very similar to Dawn, where we have our soft opening beginning on Tuesday. We have about 25 to 30 individuals between our multiple sites for people to come. Transportation will be a little bit of We Care, a little bit of Peak and Bus, and a lot of families. So be an interesting ride.
All right. Okay. I believe that's everyone on my committee's list, but if anyone else wants to give an update, I see Mark Rudolph has joined us, or anyone else, feel free to jump in.
I don't know if you can tell that Chris Mitchell joined you late.
Oh.
I'm sorry to be late.
Hi, Chris.
Hi. I have used CityLift a few times with really excellent service, but and they are clean and appropriately spaced, but most of my trips have not been essential. So I think I've used County Lift once in the last 3 months, and I was very appreciative of drivers. I miss everyone. It does tell you just how much paratransit is different from fixed route in the way that you become aware of staff individualities and things. I certainly have relationships with people on fixed route, but there is a quality of difference. But thank you for making the transportation available. The television was doing another update today about wearing masks on fixed routes and all paratransit routes, which I think is a really good thing.
Mm-hmm.
Hi, Rima and all. Mark Rudolph here. Sorry to be joining you a little bit late. Please tick the attendance box for me. I had trouble logging in. We're starting our soft opening on the 10th. Of course, any of the ICFs won't be back. We serve about 300 people in our day programs, and I'd be surprised if we get back more than 200. But we're keeping everybody in their home cohorts. There'll be groups of basically 6 to 10. Fortunately, we have a rather large facility, and the residential provider here, we don't do any residential, we just do day services, has been pretty clear that they still aren't interested in having people out in the community. So we're going to be challenging our staff to make the best they can inside the classrooms. But we miss the people so much, we can't wait to see them.
Yeah. Yeah, this meeting would definitely be better in person. So we share the same feelings. Was there anyone else on the phone or online who wants to give any sort of transit update? Okay. All right. So we actually have a quorum now. That was our number 10 and 11, and that's the number that we need. So I think that if everyone is all right with it, we'll hop back to number 3, approval of the December 3 minutes. So I have one, it was Shelley who said that there was one change to FCRT. So I guess all in favor. Did I miss a step, Hannah?
I'll move. This is Andy. I'll move for approval.
There we go.
Second.
So we have, who was that second?
Greg.
Greg. Okay. Andy and then Greg. Now it's my time. So all in favor of approving the December 3rd minutes?
Aye.
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 Aye. All right. Any opposed? Great. Excellent. All right. Thanks, everyone. Okay. So now we can jump back to number 5, to HSTP coordinator report. It's up here. So there were a few webinars and meetings that I attended virtually about IDOT COVID updates and Illinois Public Transit Association updates, IPTA. And one of the main things that stuck out there was the IPTA conference that's normally in the fall. So this year it was going to be in Peoria, where our office is, but unfortunately that's not going to happen. But the good news is that it will be next year, and they've talked to all their, I believe it'll be at the Civic Center or near it, or it's the hotel near there. But it's going to happen next fall. So that's the big update from IPTA. There's no in-person conference this year, and they considered a virtual conference, but they felt there weren't going to be enough people to attend to warrant that. So they're just moving it to next year. So everyone who was planning on going to that, maybe we'll all meet next year. Let's see what else. I'll look through my notes. Okay, this was one more thing. Yeah, IDOT has said they're working on, let's see, supporting documentation for invoices to not be as burdensome. So that's from a paperwork and administrative standpoint, that's just a small update that hopefully there'll be a little bit less to do with that. Going through my notes again. Yeah, so the IDOT COVID updates used to be weekly during the beginning of the pandemic, and now it's turned into monthly. So if you want more detail about how to join that, you don't know, or you don't have that information, just let me know. I can forward you the calendar invite, which has the updates there. And in terms of Tri-County, we have been working with the census and the Department of Human Services to help market the census. And we are now in a new fiscal year, so we've extended that contract. And we've remained with DCC Marketing, which is doing our marketing efforts. We actually have some branded masks. There's kind of a limited supply, but let me know if you need any, especially for transit agencies, but any organization that could use some. We've gotten those delivered from the census. So it's mask and it says 2020 census and it's blue. We have a lot in English, but we also have some in Spanish. Again, just shoot me an email. I can deliver those to you or mail them, whichever works out best. And also anyone who's keeping up with the news, the timeline sounds like it has changed with the census. So originally it was going to be open until Halloween, but now I guess it's open till late September. And we're still figuring out what that means for us because we have contracts and a grant through that. That was one of the big things is through the census. And another thing in our office, if anyone is interested, there's a project called the Hannah City Trail, and this has been ongoing for actually decades. It was an old Union Pacific rail line where some public agencies are trying to buy and acquire for public use. So I figure I'd bring that up now since it's alternative transportation. It would be about 25-mile walking trail that goes from Fulton County to Peoria County, and that's kind of in the works. It's going through different boards of approval to hopefully be able to purchase that. And I think those are the big ones that I had on my list. Hannah, do you have further updates?
I was gonna probably just talk about the gray area stuff, and that's the next agenda item. Otherwise, I just put the link to the article about Hannah City Trail in this chat over here. Rima did a really great job describing all of that. And then if you're interested, I think, is there a link in the article, Rima, or
no, but let me find it. There is a petition that you can sign in support of this trail, so that the point of that is just to bring it to the boards that will vote to spend money to acquire this, to say, hey, look, there's a lot of public people who want this. But I'll find it, and I'll probably send everyone an email, just an FYI.
Right, and I mean, beyond just Peoria County, doesn't it connect even down into Fulton? Like,
yes,
the potential connection going south to Canton.
So there's the current trail is just east to west, but there is another potential trail that could connect north-south up there, and that's a different Canton, or that's a different trail that would go through Canton and Fulton County and a little tiny bit of Knox County. That's like a whole, just a lot more details. So I am one of the leads on that project. I can talk for days about it, but I won't right now. But it's good because that would be a multi-use trail, so it could be good for biking and walking, and I don't know about horseback riding, but maybe horseback riding. A whole lot of things.
Yeah.
Going back. Oh, sorry. Go ahead.
No. You were mentioning that there was a change in the date. Could you repeat that? Did you say originally it was the end of October, but now it's September?
Yes.
Or did I get that wrong?
Yes, that is right. It used to be October 31st, and now it's September 30th, which is kind of a big change. We're still figuring out. It came from the very top, apparently, of the administration of the Census Bureau. And all we know is that this change is happening. We have yet to even hear more details from my personal contacts with the census. I just contacted her yesterday, and she said we're waiting on more details. So this is like breaking news as of Friday. So hopefully we can do something positive with that, but it's kind of a blow to hear that it's shortened.
Well, yeah, it doesn't make sense. They're trying to get as many people to fill out the census, and I don't know. If you're cutting the time that they can, never mind who understands them. Okay, thank you.
Unfortunately, that's all the details I have. There are some news articles about that on NPR. I think NPR was the one who broke the story. So maybe I'll add that in my follow-up email, because it seems kind of messy, but we gotta do what we gotta do.
Yeah, I would like some of those masks. This is Mary Pat. You said about 25 you could give to a group.
There is really no limit, just as long as I guess it's first come, first serve. And if we have more people, if we have more of a need for masks, then we can ask for more. So we can feel free to call me either after this call or later today, and we can talk more.
Okay, I'll do that. Thank you.
I'm making a note here. Okay. All right.
Rima, regarding the census timeline change, what's the biggest potential loss we may have to weather for HSTP if things just don't happen the way we're planning?
Yeah, so the biggest, they call them hard to count populations. The biggest hit would be to these hard to count populations, which include relevant to us here, the elderly, people with disabilities, people in rural areas, people with limited internet access, people who distrust the government, and there are others such as people with young children. The list goes on for a while, but I think those are the most relevant. So those are just the people that have lower chance of having filled that out on their own. So unfortunately, that would mean potentially an undercount in those populations. We will never know until everything is done, unfortunately, but that's the reason that we're working on this campaign, and we've connected with a marketing agency to try and hone in on those specific populations, just to make sure we can get the most we can. So, I think that's generally what would happen. Of course, there'll be ripple effects that will be hard to pinpoint, but that's the idea of the most affected people.
Absolutely. And regarding the Hannah City Trail, which board is that heading towards right now as far as the scheduling? Do we know where it is exactly in legislative agendas? Because I'm all for that trail. Obviously, it's outside my jurisdiction, but there's a lot of potential to this trail.
Yes. Let's see. We have still, I might get the timing wrong, but I know that there's Peoria County. They still haven't met yet. Their executive committee has met, but the full board has not. And the executive committee has recommended that to pass it. So basically, they're taking this intergovernmental agreement to say, once we are able, we will pay this much to buy this corridor. So Peoria County, there's also Farmington. That might have been either tonight or yesterday. I'll double check on that. Fulton County, I don't think they've had theirs yet, but I can't remember. Who else?
Rima, this is Audra from Fulton County. They discussed it last month, or the July board meeting, the county board.
Okay.
I believe agreed to it and formed an ad hoc committee for looking at funding. I'm not involved in that project, but I go to the board meeting, so.
Oh, okay. Oh, yeah. Thanks for that update. I was not aware. That's good. I believe Limestone Township is in there. There could be others I'm forgetting. It's 4 or 5, so it's not too many. But all of them would have a specific percentage, basically, to fund. I think that's all. I think I got them all. But I can look into those dates. I know that the Hannah City Mayor Fred Winteroth, he's been going to all those, all the meetings. So I can ask when those dates are, if you're interested.
Yeah. Rima, this is Mary. I was wondering, is Tri-County working with any volunteer organizations or like AAA to have them help people fill out these census forms? I know it's kind of hard to do it in a group, but if they, if somebody comes in for some other reason, if it could be suggested to their clients that if you haven't filled out your form, if you bring it in, we'll help you.
Yes. So
is anybody doing that? I know AARP is very involved, and they've got a number of things going, but I don't even think we have anything like that. Just the thought about it.
Yeah. So right now we have, we're working with the United Way that's based in Peoria. They cover several counties. They have a 211 number that you can call, where people ask about various social services. And one of the questions that the responder on the call is going to ask is, have you completed your census? So that was a really good thing that we were able to connect with them. We're also collaborating with the Tazewell County Health Department. I believe, I want to say Woodford County as well, but I'm not positive that they're doing that in 2021. Several across our region. So the region for this census grant is 10 counties, including all of the HSTP counties except for Knox.
Mhm.
So we have there's a longer list of organizations. They're mostly public, either health departments or cities. I think we have a county or two as well. Yeah. But if you want if you want to collaborate with us on that, we can help. Like I said, even get materials for you, or just see how we can help. Even just
Okay, I will. I'll talk to Springfield, our Springfield office, and see what we've got. Thank you. Thank you.
All right. Let's see, where do we leave off on the agenda? I think this is the tail end of the coordinator report, unless anyone has further comments on those. I think we're done there. Okay, so then I'll hand it off to you, Hannah. You can talk about gray area study.
Sure. I think most of you at this point have kind of heard what we're trying to do. Definitely an ongoing project for the next probably 9 months or so, taking a really close look at the area that the census has considered to be urbanized around Peoria. That makes a big difference when especially we're meeting like this, and you know that some of you guys are rural providers, some of you guys are urban providers, and they put funny rules about how you can use your resources to transport people. I mean, I'm sure they thought that it made sense, but in our case, it means that we have communities like Germantown Hills, Washington, Morton, Creve Coeur, Marquette Heights, North Pekin, who all, don't really have a dedicated public transportation service that can always get a resident to wherever they need to go. There are some services in some areas that do some things, and sometimes there is no option. So that's why we call it gray. It's very unknown. But anyway, we had our first meeting of the steering committee for this plan. That was on July 20th. Our consultant, Lockmuller Group, presented a existing conditions report that kind of showed a lot of demographic data, where certain populations are, people with no vehicles, people who have disabilities, populations over 60, basically trying to figure out where everyone is, where they're trying to go. But we're looking for any further input on what you believe to be popular destinations. So those major trip generators, because that's what's going to help determine the final destinations of where these transportation services need to go. And then we're also looking for more ideas of who to interview. They're looking to do about a total of 12 stakeholder interviews. So if you or someone else would be a really good candidate to talk about the issues that they've either heard of or faced personally, trying to get somewhere, especially in those communities I mentioned. A lot of them are on the Tazewell side, but also Peoria has had some recent loss of funding that provided kind of some patch services, looking up to Chillicothe and then going down toward like the Mossville area, and then Bartonville. Those are also considered urban, and they don't have service provided directly by CityLink, like as in they're not part of the district. There is some funding right now that's lasting, but it's not going to last forever. So all of those communities is kind of the target focus. But yeah, looking for stakeholder interviews, and then any kind of major trip generators that you know of in those areas. You can either send that information to myself or Rima. Obviously, the study is still in development, but we're definitely looking to get those stakeholder interviews done probably sooner than later. And then I think, you know, I see that Jim Bremner's here, and if you wanted to maybe talk about, he's been really good as far as knowing the issues around Washington Township, and then at the same time that we're doing this study, he's been trying to deploy a service that kind of helps solve some of the transportation issues in Washington Township. Did you have any updates that you wanted to share at this time?
Well, at this time, I am communicating with We Care and with Agency on Aging, and I will be getting with Peoria's transit system as well, to make sure that I have a correct map of who covers where, because we want to put a brochure together. What we're going to do is we're going to move mobile seniors age 65 plus. We're going to move them around anywhere in the township they want to go for free. And now we still need our partners of the other agencies that have transportation for fully handicapped individuals or other people of need that are under 65. So, you know, we still have to count on our partners, and this brochure we're going to put together is going to show a map of who do you call if you live here kind of thing. And we can only make that map so big, so there's still going to be questions, but we're also going to put in the phone numbers of all of our partners so that whoever they call first, you know, if you think you live here, call these people, call, you know, Agency on Aging first, or We Care first, or Peoria Transit first, whoever it might be. And then we also have a stipulation at the bottom. If you call that agency and they are not the one, they will refer you to the correct one. So, you know, we want to just be able to have all of the population here in our area aware of the opportunities they have to be mobile and to get somewhere, you know, we either within 61571 or Peoria and other communities. So we're in the process of structuring that, sharing it with all of our partners to make sure what we're saying is, yes, that is correct. So before we go out with it, we want to make sure we've got it right.
Wow.
Oh, that's great to hear that you're at that kind of marketing stage of this service. I would even maybe volunteer to say that you could put Tri-County's number on there as one to call if you're looking to figure out who might be a better provider. That's something that I think our role as HSTP coordinators, we're supposed to do for all the counties. And we don't get a ton of calls, but I'd say maybe, you know, at least 2 or 3 every year. I'm surprised because it's not necessarily a well-known thing, but we do get calls. I think you were one of those last year.
Right.
And then, you know, just trying to do our best and figure out, okay, if you're in Fulton County and you're trying to go over to Tazewell and, you know, maybe it's in Marquette Heights, you know, what do you do? So
exactly.
feel
I know
free
that.
to tack on.
Sorry, friend. But I know that the 211 service also needs to know the boundaries, so of who to call, so that they can refer as well. And I think we get a lot of calls actually to the city of Washington, wondering about where do we go and who can haul us. And there's still quite a bit of confusion with the boundary lines, and we're going to try to alleviate that, at least help out with this brochure.
No, that is very much appreciated. And then I see a comment also here from Audrey Barrett saying that she has a mom in supportive living in Washington. Audrey, are you able to talk further about that? Okay, maybe not, but
I can go and comment a little bit on that.
Okay.
You know, we have assisted living arrangements at several different locations within our township, and I think that, you know, I know that all of them have some sort of transportation. I've run into the issue already with people that said, look, you know, let's just say this particular housing complex says, well, we make medical trip, doctor visits on Wednesday, and then we go shopping on Friday. And if you have not called in early enough, you may not have a ride because they can only haul so many people. So I think that there is still a need in assisted living. We plan on helping that out, but I also hope we don't get overwhelmed with that need from those housing areas.
No, and I think that is an issue that we've had come up in HSTP before. Just hearing about how, yeah, even some of those assisted living places who have transportation, they have more needs than they can provide internally. So
exactly,
coordination is key.
Ooh. You're breaking. Somebody's breaking up. It's hard to hear.
Let's see if that solved anything. I might mute people if we keep having that problem.
Mm-hmm.
Okay.
All right. Well, I think that is the end of my gray area update. So if we have time, maybe go through some of the next few items here, Rima.
All right. Oh yeah, we are getting close to the end of the hour. Okay, so number 7 is discussion of new bylaws. I forgot to include these in the initial email, so my apologies. Let me open these up. So we have included them in past meeting agendas. So you might remember having read them. I will share my screen. I know that not everyone is able to see this, but I did email it out so we can everyone would at least be able to see later on. So we have these bylaws that were last officially updated in 2016, but we have some suggested changes that we have discussed in the past, so this is just a reiteration of it. This is just an update of just programs in IDOT, just different names. So this section, Article 1, Part E, is just not applicable anymore. We've changed some minor wordings on here. Let's see, there was a section that we hadn't officially said that shared seats are permissible, and that's now listed in here. Let's see what else. The biggest changes we had were about vacancies and absences. This is kind of into the nitty gritty, but for a while we just weren't able to get a quorum. And luckily today we did, but it's kind of inconsistent, and it changed with, different committee members have come and gone since then, so this might actually not be an issue at all. But essentially, if you tell me ahead of time that you can't make it, then that'll be an excused absence. But if you have too many unexcused absences, then if you down the road that might affect CVP applications. We just want to make sure we understand that not everyone can make it every time. That's not the point, is to make sure everyone can make it always, just as long as you let us know. So that's all that is. Again, that's in your email. Just some specification about voting. So again, we're not voting to change these today. This is just a discussion point. But just to bring this up one more time. And I think the next thing on the agenda was about potential chairs and vice chairs. So we brought this up at one of the last meetings, which again was a while ago. So and some people just were not even on the board at that, even on the committees at that point. So we're floating the idea of potentially having an elected chair. So currently it is me along with help from Hannah as well, but we don't have to be the chairs. I mean, we're happy to continue doing so, but if some members of the committee prefer for the committee to kind of host itself, then that's perfectly fine. We will still be here to help take minutes and help host the meetings, but just not in a chair format. And I believe that.
And I think like the major kind of bonus of that is just, you know, this should be somewhat of a forum for you guys to discuss the issues that affect you as transportation providers or as large clients of those transportation services. And, you know, we want a lot more of the discussions around this table to be guided by you all. We can maybe guess sometimes as to what's big and what's happening. Obviously, COVID was a pretty easy one to say like, oh yeah, you guys might have some changes, like let's talk about that. But beyond that, you know, the idea was just that maybe this could be a little bit more effective for you. So it's out there, it's up for discussion, obviously. But does anybody, I guess, have any comments? Or Rima, are you through with talking about it? I'm sorry.
I think that was all. Yes. Yeah, that was the end of the bylaw overview, and that is kind of a big part of it. Again, so we put this language in the potential bylaws just to have it as an option. So just because we list that there might be a chair, it's that there might be. So it's really down to what the committee wants. But yeah, I'll open up to any discussion about the bylaws or about chair, vice chair. Does anyone have further comments?
Rima, this is Brandon Hovey. I just want to say I appreciate everything you and Hannah have done. This is great stuff for these changes. As I said, I'm going to be a more committed member of this committee, but I do want to inform you both that I am going to be reaching out to you in regards to some questions in my county board district, because I have a good chunk of that gray area in my district, and hearing from Jim Bremer, seeing what he's been up to, that's been very helpful. So I'm definitely going to be contacting you both quite soon.
Okay, great, thanks. Do we have anybody who really opposes the potential addition of a chair? Or otherwise, I'm going to assume neutrality.
Right. I mean, we can take comments up until the next HSTP meeting, but I think the idea is that I think that would be what, October, that this would come back to you guys as an item on the agenda to approve. So definitely let us know if there's things that maybe you don't want to say in public in the meeting right now. We can kind of look at that even further offline.
Mm-hmm. Yeah, feel free to reach out to us if you have further comments later. Otherwise, we'll.
If you're interested in being a chair or vice chair.
Yeah. Okay. I guess going once, going twice. I'll say we can cut off the discussion for now. Let me stop sharing, pull up my agenda. I believe that was the last thing. Number 9 is other. Any other from anybody that we haven't mentioned before?
Rima, this is Mabel. I posted it in the chat, but just wanted to let everyone know that if you are wanting the on-site driver trainings through our tech, we are conducting them right now. So just contact our office and we'll get something going for you.
All right. Thanks,
Yeah,
Mabel.
Mabel, do you guys have like a minimum?
Well, since we can have up to 50, quote unquote, we're doing that. But I know the agencies that have started training so far, they're wanting to keep it to their agency, where in the past we would open it up to other agencies in the area. And I understand people wanting to be safe and cautious. And that's fine too. So we do need to at least have 10 to 15 bird training for our trainers to come to your agency though. So if you have under that number, consider doing a full agency training, or maybe waiting a little bit before you do schedule one, since people aren't wanting to do combined trainings right now.
That makes sense. Thanks for clearing that up.
Yep, thank you.
All right, any other? All right, so number 10 is adjourned. Do we have a motion to adjourn?
So moved, Brandon Hovey.
All right.
Second, Mark.
Brandon and Mark. Okay, that's all in favor to adjourn. I guess we're adjourned.
Be well, everybody.
Stay well, everybody. Cheers.
Thank you, everyone, for joining.
Take care.
Everybody.
Bye-bye.
Well.